Hello everyone, I am Dr. Mallesh, Consultant Orthopedic and Joint Replacement Surgeon at Manipal Hospital Sarjapur Road. So today I am going to talk about the hip fractures. So just few insights regarding the fracture, and before we know about the hip fractures, the anatomy of the hip goes like this: a socket and a ball so joined together. The socket is from the pelvic bone and the ball is from the femur bone, the thigh bone. So they both join together to form the hip joint. It connects the pelvis to the thigh bone, so the joint specifically, and the fractures of hip joints are more common in elderly, and it can happen with a trivial fall. So for a younger patient it requires a significant impact for any hip to be fractured, and the elderly hip fractures is more dominant because of osteoporosis issue, and there are other medical problems which can render the patients with imbalance, with immobility, and difficulty in walking pattern. Once the person falls, so if he or she injures the hip, then the patient will be rendered immobile, and the person will not be able to take weight on that particular leg, and from outside look it will be a shortened leg, and sometimes it can be rotated externally. Normally the patients require assistance to reach the hospital, either with an ambulance or with some other assistance, and once the patient reaches the hospital, then the hospital will take care. Our team involved in the hospital is the emergency doctor, the orthopedic surgeon, the physicians, the physiotherapists, the nursing care, and the rehabilitation people. Once the patient is in the hospital, the emergency doctor will look and thoroughly examine, and based on the type of injury, the other parts of if it is injured or not, that has to be ruled out, and the emergency doctor will take the detailed history regarding other medical problems that the patient might have, and the other specialties which might have to be involved later. So the aim of the treatment in the hip fractures is the early mobility. So very rarely conservative management is possible without operation. So that is with only the patients who are not fit for surgery, elderly more than 90 years, or with significant comorbidities where the surgery itself can pose a significant risk, and not being mobile early after the fracture can itself pose lot of complications with regards to blood clot formation in the legs, the heart issues, the bed sore issues, the personal hygiene issues, and otherwise. Once the patient is there in the emergency room, the emergency doctor will do the x-ray to know the geometry of the hip fracture pattern. So based on the geometry of the hip fracture pattern, the type of surgery will be. The fracture can be inside the joint, the fracture can be outside the joint, or the fracture can be in the femur bone itself. So the inside the joint fractures generally requires a replacement. So the patient is elderly and early mobility is the intent, then the joint needs to be replaced. So it can be either a partial replacement or a full replacement. For someone with requirement of minimal mobility, the partial replacement should be enough, and someone with the requirement of active lifestyle, then a full replacement is generally preferred. So for a fracture outside the joint, it's normally a fixation. So either with a rod or a plate, the fracture will be fixed, and post the fracture fixation we allow the fracture to heal, and once the fracture heals there will not be any artificial prosthesis in the hip joint, and the patient can transfer the weight with the native bone itself. That will be decided by the treatment. As I told you, the surgery will be decided on the location of fracture. So once the geometry is defined with the x-ray, and the other specialities involvement if required has to be considered. Most of the elderlies are diabetic, they have higher blood pressure, and some may have the cardiac issues. The cardiologist, the physician will involve in the care, pre-operative evaluation, and thorough blood tests and other cardiac related tests have to be done before subjecting for anesthesia. So once the cardiologist and the physician classifies the risk associated with the surgery, so then with the informed consent, generally the orthopedic surgeon will proceed with the surgery. So surgery might take around 1.5 hours based on the type of surgery done, either it's a replacement or a fixation with a nail or a plate. After the surgery, the patient sometimes will require ICU observation considering the age and other comorbidities, and if the patient is all fine intraoperatively, we can observe in the normal recovery room. So the post-op recovery has its own role in the healing of the hip fractures if it is fixed. During the first and second day, the patient will be in the bed with minimal mobility, and the physiotherapists will start their work with the assistance of mobilization. So the full weight bearing, the patient can take full weight on the leg if the joint is replaced, as in the fractures within the joint, and the patient will not take any weight, or they can take partial weight. So based on the fracture geometry, which can happen outside the joint area whenever it is fixed. And the physiotherapist also will make sure that the strength of the muscles, the hip movements, the knee movements are all regained appropriately. And post-operatively, there is always a risk of blood clot formation, which will be taken care by the blood thinner medicines. Antibiotics will be given to prevent any possible infection, and calcium and vitamin D supplements are required to help the healing process. And once the patient starts walking with the help of a walker in the initial days, so the balancing and the gait training will also be given. So the basic requirement for the discharge is patient should be independently mobile. So that generally can happen in 1 or 2 days. So gone are the days where the hip fractures were rendering the patient bedridden. Now it's all about early mobility. Earlier the surgery, earlier the recovery, and earlier the mobility, the chances of other complications are very less. After discharge, say it can happen in 1 or 2 days based on the recovery of the patient and involvement of other comorbidities. So the patient will be on blood thinners, again antibiotics and pain medicines at home, and supplements of calcium and vitamin D will be continued. And the physiotherapist from our hospital will visit the house, and they will make sure that the mobilization is continuous, and they will report to the doctor regarding the progression and if any changes of exercise pattern is required. Prevention of further fractures and strengthening of bone is also of paramount importance. So the treatment of osteoporosis has to be considered. So there are many ways of treating osteoporosis. There are teriparatide injections, there are bisphosphonate tablets and injections. So whichever is appropriate for the patient's medical profile, that will be suggested for the patient. And the idea is to walk without any support, earlier the better. And with the replacement surgeries, with the hip partially or fully replaced, the patients will be independent in 2 weeks. Without any walker support, he can be moving around. So one who goes for the fixation surgeries, that is required for intertrochanteric, the outside the joint fractures, so the support is required for little longer time, and the muscle strengthening also should be done regularly so that the recovery can be faster. A word about same fractures in a young patient. So young patient, in the sense whoever is less than 60-65 years, to have this kind of fractures will need a high impact of injury, and that impact can cause the fracture. Again, as I told, it can be inside the joint or outside the joint, and in either of the case, the idea is always to salvage the hip, to save the hip, not to replace it. And most of the times it's an emergency, and it has to be fixed within 6 hours to prevent any further shortcomings in the recovery time. And the need for replacement can be definitely avoided if in the younger patients, if the treatment is taken early. So hope I helped you to have an insight about the hip fractures. Happy and safe living. Thank you.